Hi, my name is Heather, and I'm going to be your student nurse today. Today we're going to do a head-to-toe assessment. Do you have any questions about that?
No.
Okay, before we get started, I'm going to go wash my hands, okay? Okay. Can you tell me your name?
Been good.
Great. Can you tell me what state we live in?
Arkansas.
Great. Can you tell me the month and the year?
October 2014.
Okay, and what brings you in today?
I need to get my legs looked at.
Okay, great. So good speech, good mood and effects, speaking appropriate, behavior appropriate. Can you tell me if you're having any shortness of breath, any heart palpitations, or trouble breathing?
No.
Okay, there's no acute distress, there's no mass or major deformities that are visual. First thing we're going to do is we're going to get your vital signs, okay? We're going to start with your temperature. You can just place this under your tongue. Okay? 98.6 degrees Fahrenheit, and that is normal. Okay, and I'm just going to scoot this over here so we can place your blood pressure monitor on it. I'm going to take your blood pressure, and while the blood pressure is going, I'm going to go ahead and listen to your respiration rate and your pulse. I'm going to split that in. Go ahead and turn this on and then start. Okay. And pulse is 65, respirations are 14. And blood pressure is 126/74. All of that is normal. I'm just going to turn this off. And place this back up there. Okay. His Glasgow Coma scale is 15. Everything is appropriate. Next thing we're going to do is we're going to check your cranial nerves, okay? And then we're also going to do I just kind of look over of your skin, okay? So first we're going to start with the skin though, okay? So we're going to just kind of look. There's no abrasions, there's no masses. One pustule, there's a scar. What is that from?
Childhood football injury.
Okay, and then I'm going to right past it. Okay, I'm going to check your radial pulses. Okay. and they are +2 bilaterally. And check your brachial pulse. And they are +2 bilaterally. I'm going to check your tap refill. Okay, you know it's 2 seconds bilaterally. Okay. And then I'm going to go ahead and bring this over, okay? And there are no edema, there's no masses, everything is symmetrical. Go ahead and place your feet up here. Okay. No edema, no nodules, masses, and it's symmetric. There's scars to both knees. On the right knee, there's a scar under. What are those from?
Possible.
Okay, when was that? Okay, like when you were a child or? Okay. And there's a few areas right here. They're healing from previous pustules. And what is that from?
Fire ant panel.
Okay, and it looks like it's on its side of healing. I'm just going to check your tap refill. And it's 2 seconds bilaterally. Your graphic pulses. And it is 2+ bilaterally. I'm going to check your posterior tibial pulses. And they are +2 bilaterally. Now I'm going to check your popliteal, which is behind your knee. And your skin feels warm. And you can just up here. Left popliteal pulse, 2+. Okay. Lift it up. Right popliteal pulse is 2+. Go ahead and take that down. Skin is soft. It's slight dryness on the bottoms of the feet. Skin is elastic. The curve is elastic. Okay, go ahead and I'm going to slide this out and touch your feet down. Okay. So next we're going to check your cranial nerves, okay? If I can ask you to close one nostril and close yours and tell me what you smell.
Vinegar.
Great. Maybe you can do the same on the other side.
Peppermint.
Good. Okay. Everything just follow my finger. Okay, and then if you can read this part right here from the card.
Disease idiotitis causes the brain to shut down and the mouth to keep talking. Thousands affected, might be contagious. Best defense, slapping none.
Okay, great. Okay, so now I'm just going to check your pupils and how it reflects the light. You're just going to go with the eyes. Again, the other eye. Okay, and again, the other eye. Okay, good. And then we're just going to lift your eyes if you'll look down. Okay? And up. Okay, and up. Up. There you go. And down. Okay, and if you'll look behind me, and then I go up. Great. Okay, curl your pupils are furrowed. They're equally round and reactive to light for good accommodation. Both upper lids and lower lid conjunctives pink, square white. Irises are green. There's no abrasions. There's no masses or swelling or drainage. If I could look at your nose. Okay, septum is midline. Nerves are equal. Mucous membranes are pink. Okay? And if you could open your mouth for me. Great. Okay, and clench your teeth. Great. If you could do that again. Okay, and close. Okay, there's full range of motion, or full range of movement of the jaw. There's no masses, there's no swelling. Now if you could, I'm going to just lift your mouth, okay? First we're going to look at your throat, and then we'll check your gag reflex, and your movements your time, okay? Okay, and right, there you go. Okay, off. Okay. Uvula is midline, tonsils are of course one, and then our teeth are white, mucous membrane is pink, teeth are in line. Then we check gag reflex, okay? Okay. And then and you could just move your tongue up to the top of your mouth, great, and down, great, inside to side. Good job. Okay, now we're going to test your ability to feel, touch on your face symmetrically. So just tell me if you feel what you feel, if it's sharp or if it's soft, and if it's on both sides of your face. Okay? And close your eyes.
Soft. Soft.
Okay.
Soft.
Okay.
Sharp.
Okay.
Sharp. 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 Sharp.
Good. And you felt it on both sides equally? Okay. Now, do you have any sinus problems or drainage with your nose? Any tingling or in your face? Any trouble feeling? No? Okay. If you can shrug your shoulders and then release. And then with resistance. Okay? And release. Okay. There's all that appears to be normal. If you can all the cranial nerves and your good muscle strength. You can tell me when you can hear my energy like this, okay? Okay? And then I'm going to whisper. If you can just repeat the words that I say, and then we're going to start with this here and the left ear so that we can cover your right. Good. And on the opposite side.
6. T. S.
Good. Okay. And I'm going to wiggle my fingers. Just looking at me, I'm going to close my left eye. If you can do the same. There we go. And just tell me when you see my finger wiggle. Okay?
Okay.
And switch.
Okay.
Okay. This is part 2 of the head to toe assessment. Continuing, we start with head. Palpating. Also inspecting. There's no masses or indentions, no abnormalities of any sort. There are no flakes. Hair is distributed evenly. It's shiny. You can go ahead and look at your ears. And they look symmetric from this viewpoint. There's no redness, no lesions. No redness, no lesions. There's scant amount of earwax. Come over to the right ear. And scant amount of earwax also. And there's no redness, no lesions, swelling, pressure strokes, abrasions, anything of that sort. I'm going to go ahead and look at your for jugular vein extension. We'll look for tracheal alignment and for your carotid. Okay? So we'll start with the right side. We're going to go to a 45-degree angle. Okay, jugular vein distension is not noted. It's not present. Carotid pulse is noted. That's on the right side. Looking on the left, jugular vein distension is not noted. Okay, and carotid pulse is noted. Pulsation is noted. I'm going to check for tracheal alignment. And there's nuts on the left side. Okay, and the trachea is midline. There was no goiters or masses felt. Was there any tenderness? Have you had any trouble with tenderness or drainage or anything of that sort? No? Okay. I'm going to go ahead and feel over the carotid. Representing the left side, carotid pulse is 2+. The right side carotid pulse is 2+, so it's 2+ bilaterally. We're going to auscultate or listen to your carotid pulse. If you'll just take a deep breath each time, okay? Deep breath. No bruise are noted to the left carotid. Go ahead and let that breath out. Take another deep breath. And no bruise are noted on the right carotid. Okay. Next, I'm going to go ahead and check your neck strength and range of motion. First, your range of motion. If you can tilt your head back. Good. Tilt your head forward. Good. Up. And to each side. Good. And now rotate it to each side. Good. Neck has a full range of motion. Now, you'll do the same thing. I'm going to press against your cheek. Good. Other way. Good. Now bend it. Bend it back. Good. And forward. Good. And to the sides. Okay. And neck strength is 5. Okay. We tested the shoulders in part 1 for strength and range of motion. So we're going to go on to our lungs. And first thing I'm going to do is go ahead and just and stacked all the way around, and then we'll go individually to your anterior laterals and posterior. So if you just sit up off for a minute and just breathe. And if you can place your arms above your head like this, like so, good. And take the lateral. And deep breath. Okay, good. And rest your arms. Breathing is the same pattern. It looks symmetric. There was no concaving or convexing, no barrel checks noted, normal contour. Throughout the rest of this assessment, I'm going to have to look up your shirt on first. Is that okay? You're comfortable with that? Okay. So the first thing we're going to do is anterior. I'm going to go ahead and just palpate. And we're going to test for tactile stomatitis, so you'll just say 99 each time I tell you. Okay? 99.
99.
Okay.
99. 99.
Okay.
99. 99. 99.
Good. Tactile stomatitis was noted as symmetrical on both sides, so bilaterally, in between the intercostal spaces. I'm going to go ahead and cut, okay? Maybe you can lift your arms above your head. Great. Okay. Good, and go ahead and rest your arms. Resonance was noted in between the intercostal spaces bilaterally. And go ahead and auscultate, and this will have to go onto your skin. Okay, and we're just going to start above here. And deep breath. Each time touch it, okay? Good. Mm-hmm. Mm-hmm. Good. And one more time. Good. Lungs are clear in all lobes. Chest muscles are aligned. And there were no masses noted on palpation. On auscultation, there's again clear in all lobes, and no coarseness or losing noted. We're going to move to the lateral side. This is right side lateral. Just put your arms above your head. Okay, so then we're going to palpate first for any sort of masses. No masses are noted. We're going to do the 99 again. So you say 99.
99. 99. 99. 99.
Okay. Tactile stomatitis is noted. And you can go ahead and rest your arm before your application. There's resonance noted, and the popping was actually my finger popping. There's no crepitus. Was there any tenderness? No tenderness, no masses. I'm going to go ahead and auscultate. And hold your stretch. You're going to put your arms above your head. Okay, great. And deep breath. Good. Okay, good. Lung sounds are clear and all limbs on the right. I'm going to go ahead and go to the left side for symmetry between the right and left. So if you could raise your arms above your head again. And again, with topic first. No masses, very any tenderness, no tenderness. Again, 99.
99. 99. 99. 99.
Okay, patho is, rest your arms for a second. It is, patho is noted and it's actually symmetrical, left and right, so bilaterally. There's no, again, there's no masses or tenderness, noted, no, crepitus. If you'll, raise your arms again for chest. Okay, and go ahead and rest your arms. Resonance is noted on percussion. These are all these normal, no abnormalities, no hyper resonance or dullness noted. And then I'm going to go ahead and listen. And rest your arms and rest with your shirt. I'm standing to rest my knees for a second. Okay. And go ahead and deep breath. Deep breath. Deep breath. And deep breath. Good. Turn out your arms. Left side is clear in all lobes. There's also noted, I wanted to point out there's no axillary muscle use. It appears to be no work of breathing. Have you any trouble breathing?
No.
Any congestion in your chest or anything like that? Okay. For that posterior, I'm going to have you actually overturn towards me versus leg. And I'm actually coming over here. And if you'll just rest your elbows on your knees and bend your head forward. Great, just like that. Okay. And again, we're going to start with palpation. And I'm just checking for any kind of mass or anything. There's no masses or nodules noted. Let me go ahead and feel in between the intercostal spaces. Feel this T99.
99.
Right.
99. 99.
Okay.
99. 99. 99.
Good. Patho is symmetrical on both sides and posteriorly. Go ahead and do you need to rest your neck?
Yeah.
Okay. Good. can turn just slightly a little bit more. There you go. Okay, great. You can go ahead and sit up for a second and rest your back. Resonance was noted throughout the percussion. And next we're going to auscultate, and then we're going to check for lung expansion. After that back, we're going to check for lung expansion, and then we'll auscultate. So I'm going to lift your shoulder up just slightly in the back. And if you will go ahead and take a deep breath. Okay, lung expansion is symmetric and not some smooth out and even. There's, upon inspection, there slight breakout hair and lower back. We'll go ahead and auscultate. And then I would have to go skin to skin. Deep breath each time it touches. Good. Again. 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 Last time. Good. Lungs, posteriorly, they are clear in all lobes. Next, your next kind of this way. And go ahead and we're going to check, do your musculoskeletal assessment, and then we'll do the sitting part of your heart assessment before we change the line down. Okay? So if you could stand up for me, please. I think you lift your arms over your head and cross them together. Good. Bring them back. And if you could turn from side to side. Good. Good. And from down, can you straighten your arms and bend them at your elbows? Good. And do just as I do. And then, good, and roll. Good. Now we're going to take your hands, if your arms are still just push against me. Good, and the other way. Good, and with your hands. And the other. In the back. There you go, push against. Good. Okay, full range of motion in arms and wrists. Strength is 5 out of 5. Arms and wrists, and all of that is bilaterally. If you want to bend your back, like so. Good. And bend down and touch your toes. Good. And laterally, so bend to each side. Good. Good. Full range of motion in spine. If you'll go ahead and have a seat for me. Good. Okay, and if you will lift your leg up and bend your knee up. Good. And if you'll lift your leg up, bend your knee up. Good. And if you can cross one leg in front of the other. Okay. And the other way. Good. Now while you're sitting here, if you can do as I did, if you can do this. Now do it as fast as you can. Faster. Good. And slower. Good job. Good rapid hand, alternate hand movement. Now, if you can do your feet, if you can turn them down and then up, or them around. Good job. Okay. I'll put them up here. other way. Good. And this way. Good. And the other way. Good. Okay. Full range of motion on legs bilaterally, ankles bilaterally, 5 out of 5 on strength for legs bilaterally and for feet bilaterally. Go ahead and do that. Now we're going to check your patellar reflex and your brachial reflex, okay? You'll just relax your arms for me. Good. Okay. 2 plus on 2 plus on reflex for brachial. And you'll just split your legs out. Okay. This is patellar reflex. And that is normalized for good. So patellar reflex bilaterally normal and it's 2 plus and brachial reflex is going to auscultate we're going to auscultate the breath sound, or sorry, heart sound. I just want to take note that this is an amplified stethoscope, so in order to switch to a bell, all I do is just simply press that button and then switch back to the diaphragm. So in order to do this, I'm going to need to lift your shirt up. Okay. This is aortic. S1 and S2 are heard. It's pulmonic. S1 and S2 heard. Earth point. S1 and S2 heard. Tricuspid. S1 and S2 heard. And mitral or mitral. S1 and S2 are heard. Switching to the bell. There are no extra heart sounds heard and no murmurs in any of the locations. So regular rate and rhythm was noted. This will conclude our sitting portion. Next we'll have Mr. Good lie down for the next section. Continuing with the lying down portion. Muscles are large. You exercise regularly, lift weights, okay? And they're symmetric. We're also going to test for clonus. Here. No clonus noted. Now listen to heart sounds. I'm going to need to lift up your shirt. Yeah? Okay? And then this is with diaphragm on. S1, S2 heard, and aortic pulmonic, tricuspid, and mitral. We're switching to the bell. There are no extra heart sounds heard. There's no S3, S4 heard, and there's no murmurs heard. There's a regular rate and rhythm. Now we're going to go on to the abdomen. You just keep it straight up for me. Keep here. Right down, and push your arms out to the side. Great. So, spacing the abdomen, tear to really evenly, the umbilical is in line. It's flat. We'll go ahead and auscultate. Vowel sounds are heard normal acid in all 4 quadrants. Are you having any trouble with nausea or digestion? Any tenderness? Okay. I'm going to go on to lightly percuss, and just let me know if there's any kind of tenderness, okay? You can just put this hand down. Okay, there's no tenderness noted in all 4 quadrants upon light palpation. There's no masses, there's no abrasions or anything of that sort. We're going to do deep palpation now. So this is the deep palpation. Just let me know if there's any tenderness. Tenderness. There's no masses noted. There's no rebound, tenderness, no rigidity, and there's no. And also, when they said there's no aortic pulsation noted, we're also going to finish up with just checking clonus. Clonus is not there. You bilaterally. You want to also note that the nails of the toes are even. They're short. They're smooth. And also looking here, just so that you can see a little bit better. Nails are actually shorter than normal. You bite your nails. So, is that anxiety or? So we want to know anxiety, and the coping for that would be the biting the nails. They are smooth, it's just irregularly short. That will conclude our head to toe assessment. Thank you.